Good evening, and welcome to Let's Just Talk. I'm your host, Hami. According to a leaked draft opinion published by Politico, a majority of Supreme Court justices are prepared to overturn abortion rights in the United States. The draft opinion, written by Justice Samuel Alito, would strike down Roe v. Wade entirely and overturn Planned Parenthood versus Casey. The draft reads, Roe was egregiously wrong from the start. We hold that Roe and Casey must be overruled. It's time to heed the Constitution and return the issue of abortion to the people's elected representatives, end quote. To help shed light on this issue of abortion, we are joined by Dr. Alicia Ely Yamin and Ms. Kelly Blanchard. And to offer their perspective on this issue, each of the guests will have 5 to 7 minutes. And Dr. Yamin here is currently a professor on sexual and reproductive rights in comparative and international perspective at Harvard Law School. Kelly, on the other hand, is also a researcher and the president of Ibis Reproductive Health, a global research and principal partnership that advances reproductive autonomy, choices, and health worldwide. Dr. Yamin, Kelly, welcome to Let's Just Talk. We're happy to have you here.
Thank you.
So like I mentioned before, each of you will have 5 to 7 minutes. Dr. Yamin, we're going to start with you, and then we're going to go over to Kelly, and then we're going to delve into the questions that we have for you today on this topic.
Terrific. Well, thanks very much, Hami, for the invitation. It's really a delight to be in conversation with a good friend and colleague, Kelly Blanchard, about this very timely topic. And before I give us a little bit of background on how we got to where we are now with abortion, I just wanted to mention that as we are speaking, today is there's a call for a walkout and rallies around abortion rights in cities around the country. And as much as it is important to listen to people who've worked in the field for a long time, right now I would emphasize that it is extremely important to get up and stand up and let your voice be heard to your elected representatives and people who are running for election in this country. So to step back just a little bit, Roe v. Wade came after a very important decision on access to contraception for married couples, Griswold versus Connecticut, which located the right to access to use contraception, that one in the case of married couples and later unmarried couples, in this notion of a penumbra of privacy in the 14th Amendment to the Constitution. Roe v. Wade was decided in 1973, also under that privacy standard. Privacy is, those intimate decisions are crucial to the self-determination of, at that time it was women. Now we know that it's not just women who are pregnancy-capable people. And Roe v. Wade established two things. One was a viability standard. So prior to viability, women really had quite unrestricted access to abortion under law. And it also set up a trimester framework. I say under law because it's important to recognize that from the beginning there has been a difference between legal entitlements to abortion in this country and actual access. And from the beginning, there was a big pushback that tried to limit access by, first having the state not obligated to pay for poor women's abortions, and then a shift in different kinds of restrictions put on actual access. In Planned Parenthood versus Casey, which was 1992, the Supreme Court eliminated the trimester framework, reaffirmed that women have rights to abortion before viability, as well as under limited circumstances thereafter, but set up this idea of they have rights to access abortion, but those can be restricted or limited in certain ways as long as those restrictions do not impose an undue burden on the rights of the pregnant person. And that's what's at stake in the draft leak opinion, which may just throw out that idea that there was a right to exercise reproductive autonomy and choice located in this penumbra of privacy. And the leaked draft states that the undue burden test set up in Planned Parenthood was just entirely unworkable from the start.
Wow. Okay, thank you for that. And Kelly?
Thank you. Such a wonderful summary of where we've been sort of over the trajectory of the Supreme Court cases on this topic. To start, I think a couple of really important facts, I think. The first is that abortion care is very safe and very effective. We have decades of research on the various technologies and methods of abortion care, and there is this misinformation that's often out there that it's somehow dangerous. And linked to what Ali was talking about undue burden, many states have tried to argue for restrictions under the guise of, they usually use the term women's health, and that abortion can somehow be dangerous for women's health. And so I just want to reiterate, abortion is safe and effective. It's safer than many other common medical procedures, many other things we do in our everyday lives. So I want to start off with that fact. I think it's important. Second is, and Ali said this a number of times, so just to reinforce, this is a leaked draft, and until we get a final decision from the Supreme Court, abortion is legal in the United States. And so the press and conversation on this topic in some ways is really welcome, because there often is not enough attention to the fact that people have the right and should have access to abortion care. But of course it comes in this moment when that right is potentially at threat. So just going on to a couple of other pieces that are relevant to what we focus on at IBIS and our work. And again, Ali alluded to this, is that access, even with Roe in place, has been a challenge for many groups of folks. And our research really focuses on ways to increase access to care, both in the United States and outside the United States. And what are the ways we want to change policies to improve access to care, make more products accessible, and to use technology and other advances to make services more responsive to people's needs. And so just a couple of examples. In the pandemic, many people became much more familiar with telehealth care as a way to access care. We also saw that transformation when it comes to abortion care. People, we did research about this 10 years ago, but under the pandemic saw an amazing transformation where telemedicine for medication abortion actually became much more available, and people could talk to a provider either on the telephone, using teleconferencing, and then have the pills shipped to them at home. And it has long been known and documented in the research that people can manage their abortion process at home on their own.
Okay. Oh, go ahead.
Oh, thank you.
Yeah.
And just to tie that up, and the World Health Organization recently released updated safe abortion guidelines, which really emphasize that people themselves can be safe and effective providers of abortion care, especially early in pregnancy. So I wanted to talk about that. Second, the question about state level restrictions and the ones that have been argued, the states have argued that they don't present an undue burden and have been left to stand. Many of those restrictions mean that people struggle to pay for their abortion care, that they have to go through many unnecessary medical procedures, and they often take a lot of time to overcome those various state restrictions. And so at IBIS, we've been looking at ways to analyze the impact of those restrictions. And a quick summary is that preventing people, for example, from having their insurance cover abortion care, preventing people from being able to access clinics close to where they live, really push people later into pregnancy for their abortion care, and also cause them to go through hoops that put their families at risk, their financial well-being at risk, and really, again, I can't emphasize enough, medically unnecessary sort of hoops that people have to go through. So those are really important. And I think what we'll see is that, and we're already seeing it even before the decision has come down, those kind of restrictions will proliferate, and people who are working to make ends meet, Black people, Indigenous people, other people of color, Latinx folks, young folks, people who our systems today really don't serve are the people, again, who are going to be facing some of the most significant burdens of these increased restrictions.
Thank you for that, Kelly. There's so much to unpack and have conversation on everything that you all have said. But to get us started, abortion is still legal. But in the draft opinion, there's a likelihood that it won't be soon. And so if Roe is overturned, what can we expect? You know, what does a world without Roe looks like? For many of us who are of the younger generation, we don't know what that world looks like. We've always existed in a society with Roe and Wade. So now Roe is no longer, I'm gonna put it forth to you for you to explain to us what it is that we should await ourselves to see in the coming weeks.
So just to underscore what Kelly said, it is a leaked draft opinion. There people who are in this field were unsure about whether we all anticipated that the protections under Roe and Casey would be chopped away at, undermined, but it was not absolutely clear to people who follow this whether, for example, Chief Justice Roberts seemed to suggest that possibly the 15-week time set under the Mississippi law might be a sufficient standard instead of viability. But it appears now from this leaked draft that the court is just going to return the issue of abortion to the state. So there will no longer be a minimum federal threshold or standard. And that means, like other things that are sent to the states, that there will be enormous variation and, in turn, enormous inequity. We already see a rash of conservative states passing legislation to dramatically restrict abortion rights. Oklahoma was the latest and probably most draconian. And then we see, on the other hand, progressive states, including Massachusetts, that have moved to pass legislation to enshrine in statute or in state constitutions rights to obtain abortions. And now we're seeing movements in those progressive states to protect providers and women, but providers who, because this is going to unleash a lot of complexity. Women are going to travel across state lines, et cetera. If there's telehealth, there may be a provider in one place speaking to somebody in another state. So there's a lot of legal complexity about what standards apply. So we're seeing a lot of movement in progressive states to protect the provision of abortion by their providers, the residents of their states, and for women when they travel to their states.
Yeah, I think the sort of wide separation between the environments people are going to be in is really important to understand. Sadly, we already have a few examples we can look to about what the impact will be. The most obvious being Texas, where Texas SB 8 went into effect in September of 2021. And the Supreme Court chose not to strike that law down. And essentially what it does is bans abortion before 6 weeks of pregnancy. So it's not a complete overturning of Roe, but it bans abortion at a very, very early gestational age. And the impact has been people having to travel out of state who need abortion care. We've seen dramatic increases in people seeking abortion pills online, abortion pills from online services who serve people in restricted areas. And we also, it's hard to know exactly how many people, but some proportion of people won't be able to overcome the distance barriers or the cost barriers, and so they will be forced to continue a pregnancy that they would have preferred to terminate. And we know there's a very large study my colleague Diana Green Foster at UCSF conducted called the Turnaway Study that looked at people who were denied abortion care that they sought based on restrictions in different states. And what she documented very clearly, and what we expect to happen, is people who don't get abortion care that they're seeking, they're more likely to be in poverty. After that experience, their children are more likely to be in poverty. They're more likely to have to continue in abusive relationships. So there are a real series of important implications for people who are not able to act on their desire to end a pregnancy.
So can I pick up on something?
Yes, of course.
All of those impacts we absolutely have seen. As a point of law, SB 8 really did. I mean, it absolutely did. It was inconsistent with federal constitutional standards as it was written. But what it did, which is quite nefarious, is that instead of the state enforcing that, which then people could have claimed was unconstitutional, it allowed individuals, sort of vigilantes, to enforce it. And that made it very difficult to challenge. And I believe we're going to see many more examples of those kinds of laws, including trying to prevent pregnancy-capable people of crossing borders to obtain abortions.
Yeah. Now, I have, just to follow up on what you said, I have two questions separately for each of you. The first one being that we're aware that on the national average, this is not state by state or in different localities, that Black women are 3.5 times more likely to die due to maternal mortality in the United States than their white counterparts. And so how does overturning Roe specifically affect people of color, people in low-income areas, and the most vulnerable? And then for you, what kind of arguments have been made by Samuel Alito in his leaked draft as to why it makes sense to overturn Roe, or why is it egregiously wrong? Because he hints at like the 14th Amendment and how this is not, a text-based ruling, and talks about the fallacy, there's that whole fallacy of enumerated rights. And from my perspective, I'm not a constitutional expert by no means, but if the argument is we can't do something because historically we haven't been doing it, there's a lot of things in this country that we can keep going back and regressing into, so I'm going to put that forth and let you address it.
Well, so just on the racial issue, and this is an issue of racial justice, right? This is our health system. It systematically discriminates against people of color. We saw that in COVID and disparate impacts of COVID. We see it all the time. Women in general are more subjected to the abuse and neglect from the health system because they need reproductive health care. They take care of kids, so they experience, women of color experience their marginalization, experience obstetric violence, experience neglect through the health system, as I think more so young men of color experience it through the criminal justice system in this country. So it's absolutely a racial justice issue in every way, and democracy issue, I would say. On the reasoning that Alito gives, there are a number of different ways to read the law and read the Constitution, interpret the Constitution. He considers himself what's called a textualist or an originalist, which is theoretically reading the Constitution in light of what the founders, what the original plain meaning of the words was when the founders were around, or in this case, when the 14th Amendment was drafted. That is one understanding of reading the Constitution. In this particular case, it's really not, and this has been pointed out by many, it's not really so much textualism or originalism, it's sort of what a bunch of old white guys might have thought about this issue, because obviously abortion was not mentioned in the 14th Amendment or mentioned by the founders. And as you said, Tommy, there are a zillion other things that weren't mentioned. So, reading in to what the founders thought seems sort of a contrived and artificial, really a stretched artificial exercise, because it would kind of paralyze the Constitution in one way. And it's controversial, right? I mean, maybe some people thought a certain thing, but there's plenty of evidence to suggest that there were traditions of abortion by traditional midwives and in communities throughout this nation's history. The criminalization of abortion has more to do with forced slavery and with our equally ingrained tradition in this country of enslaving Black people and exploiting them and exploiting their reproductive capacities. So, there are arguments both ways.
Yeah, and to add to that, in terms of the 14th Amendment, a huge chunk of it is about giving bodily autonomy to former enslaved people. And so, if we think about it, that could be argued that has to do with their capacity to choose or not to choose to bore children, because as we know, during those times, slave masters used to force Black women to bear children, whether it is their own or forcing, their subjects to populate the slave population. And there's even, I was listening to a podcast, I forgot where I heard this, but it was mentioned how Black women during those times used to use the bark from like cotton plants to perform abortions because they didn't want their children to be born under those conditions at the time. So I guess I just wanted to add that to your take, and then let Kelly give her point of view on this issue.
Yeah, just to lift up the clear point you made, this clearly is a racial justice issue, and there's so much about our healthcare system that does not serve people equitably or fairly. And I want to really make a shout out to my reproductive justice colleagues. And so in 1994, a group of Black women came up with the reproductive justice framework, which really advanced us beyond what had been a very narrow choice framework for thinking about abortion. And what I have really learned from those colleagues, what I think is really important to me about that framework, is how it pulls together some of the core pieces. It says that people not only have the right to choose whether or not to bear children, they also have the right to raise the children they have in environments that are safe and allow those children to thrive. And so just tying back to your question about maternal mortality, these are all decisions that people should be able to make with support and with the ability to have a safe and healthy pregnancy if that's what someone chooses, or access a safe and effective abortion if that's what they choose. In terms of, we also see many ways that these systems don't serve people of color. And just going back to the point about coverage and insurance, for example, we know that many of the public sector programs that support people working to make ends meet are both poorly funded and really don't meet the needs of many people who need health care. But in many parts of the country, predominantly people of color, the fact that we prevent systems like Medicaid, that is the health insurance plan for people with low incomes, because that plan cannot cover, the federal part of the plan cannot cover abortion care because of the Hyde Amendment, that has a disproportionate impact on lower income people and people of color in that program. We do have a number of states, including Massachusetts, where states have decided to use their state Medicaid funds to cover abortion care. And I think this goes back to the point we were talking about earlier about how we're seeing progressive states that in the light of this pending potential overturning of Roe, that progressive states are trying to think of ways that they can both increase their support, both for people who live here for their residents, but also California is another example where they're putting specific funding in place for people who are going to need to travel from out of state to be able to access care. So I think as dire as it feels thinking about this decision, there also, over the past few years, for example, we've seen a couple of new states, Illinois being one, that decided to cover abortion within its state Medicaid program. We have seen Massachusetts, Virginia, California as examples pass laws to expand access to abortion care to cover more people, to protect access to high quality care. So it's a very, as dire as this moment is, there are reasons to be hopeful.
Okay, thank you so much. And a big part of the debate over abortion has been centered around, as you mentioned, viability, or when life begins. So for you all, how do we determine this? How do we have this conversation? Does it begin like, some Orthodox religious people might say, at conception, or does it begin when I'm not even going to attempt to answer that question. I'm just going to leave it for you to answer the question about, how do we have the conversation across difference about when life begins, or is that even the important question to ask?
This is obviously a deeply contested issue, as you said, across religions and philosophical debates. Despite what we know scientifically, I mean, I think whether you believe that conception relates to fertilization, or whether you believe that conception relates to implantation, actually, and the importance of viability, of when, the importance of the viability standard was that the Supreme Court at the time recognized there is something different about a fetus that is dependent on living inside the mother's womb, and a fetus that could live on its own. But that standard has shifted over time with medical advances, and it's variable depending on whether the woman, how healthy the woman is, what the status of the pregnancy is. There are a lot of, if she's carrying twins, or, I mean, there are a lot of different factors that affect viability. I would say, and I'm curious to hear what Kelly says, that in other places, there has been more emphasis placed on, not to sidestep the moral and ethical debates, but there's been more emphasis placed on how the kind of conditions that exist in pregnancy-capable people's lives, and that placing this particular burden, the burden of carrying a pregnancy to term, is one that we do not place on any other sector of society, and it's unlike any other burden that we place on anybody in society. So just think, Hami, for example, of the outrage that asking people to wear masks during COVID caused. So these new rash of laws being passed are asking a sector of the society not to wear a mask, but to allow their entire bodies to be taken over for 9 months, which will have health consequences no matter what, and mental and physical, and economic and social consequences, et cetera. So that kind of sui generis burden is really extraordinary. And in many other constitutional and legal contexts, that has been recognized.
Thank you for that. Kelly, would you like to give a take on this?
Yeah, just to lift up one of the points Ali made about the science of viability. I think that people may, of course, hold a very sincere belief based on their religion, based on other personal circumstances, but I mean, we of course have other parts of the Constitution that indicate that we don't believe that one religious belief or approach should be legislated or forced on other people. And so for the sake of this moment, let's put the potential religious viability or definition of life aside. But thinking about the science of it, there are so many individual circumstances that impact viability that it has to be determined on a case-by-case basis. There really is no way of knowing, this isn't something, I think people often have this idea that like, oh, you sometimes see, oh, it happens at 22 weeks. Oh, then it's viable. But I think it's important for people to know that's not always the case. And of course, at any point, there are going to be quality of life questions. And so is really just life the answer? And again, individuals and families and people involved in any pregnancy may have different opinions about that. And so I think the core piece here is who should make those decisions. And we see, I think, time and again that politicians are not the people who are going to manage either the physical consequences of carrying this burden, nor the economic or other consequences of raising children, which is a significant commitment. And so politicians should not be the ones making decisions for people about this. It should be made by the individual pregnant person, the people that they want to include in those decisions, their family members. That could be a religious figure, that could be others with whom they share their lives, their communities. But that very fundamental question really isn't one I think we can answer in a state legislature, and certainly not state legislatures that completely do not represent the what our country looks like, all the people involved. I mean, we have 28% of our Congress is women or something like that. I'm sure my figure is off for the exact moment that we are, but we really are far from having a government that reflects all of us and our various identities and circumstances.
Thank you so much for that. I'm not sure if you were going to respond, but if you are, I'm going to let you do that, or else I have another question.
No, I was just going to say, I think the court is showing that it doesn't reflect the population of the United States and the over and over again values and desires of what people have stated. The vast majority of people in this country do support Roe v. Wade.
Thank you for that. And so that brings us to I'm not sure how important this question is, but how do we get past the cultural divide or the perceived divide that exists on this question of abortion? Or is there even merit in trying to work across differences on this issue? Or should we just say, majority of people support this, and ethically you stand where you stand, and so, the hell with those who agree or don't disagree?
Well, I think the majority of people do support, there's a big middle ground that I think is getting lost in much of the public discourse and is somewhat manipulated by kind of radical extreme measures in Republican-controlled legislatures in many states. There really is a big middle ground of supporting generally the kind of framework that Roe v. Wade set out, rights to abortion with some restrictions under some circumstances. Is it worth talking to people who have different beliefs than we hold personally? Of course. I think that's part of what democracy is about, right?
Yeah. And then, so there's a lot of things that the leaked draft opinions address, but that are not being highlighted in the media. For example, what would be the consequences? What other issues are at stake if the draft opinions happen to look like the opinion that will come from the court? what are other factors, other privacy issues that may be at stake with this issue?
So there's been a lot of commentary about this because Alito makes one remark about how this is only limited to abortion. But there's no reason to believe that the reasoning he gives would be limited just to abortion. It could, for example, apply to same-sex marriage. It could even apply to contraception, right? As the case I mentioned earlier that preceded Roe was about contraception.
And then on Twitter, you mentioned self-management of medical abortion. And so what is that exactly? What are abortion pills? How can people get access to it? And why is it important for us to know about this?
Yeah. So when we say self-managed abortion, what we mean is an individual, accessing a method of abortion and going ahead and having an abortion without the going to a trained healthcare provider, right? So there are a wide range of different support that you can have. So there's self-managed abortion where, for example, I can go online and order pills from an online pharmacy and just take them myself. There are also some very exciting feminist healthcare models that have been developed outside the United States. One model is called an accompaniment model, which is community-based folks who are not trained healthcare providers who will support you through the process. So they have information about how to help you get the medications in some cases, how to what to expect. They're there as a resource if you have concerns or questions. So that's a version of self-managed abortion, so you're not going to a formal healthcare provider, but you have some support. Similarly, in some contexts, there are hotlines. So you can get phone support from a counselor. This is true in many different countries around the world. And we're also seeing, and this has been growing over time in the United States as well, in part because of increasing state restrictions over the past decade. And now also since this leaked opinion, for example, we've seen dramatic increases in people going to online providers. There's a group called Aid Access, for example, that serves people in the United States. You submit information to them via an online form. In that case, a healthcare provider reviews that form, but it's asynchronous. So you submit it online, they look at it separately. If they think you're eligible, they will write a prescription for you and the medication will be sent to you.
Okay.
So those are a bunch of models, and all of those models are ways of accessing medication abortion. So some people call it medical abortion. It's basically what people colloquially often refer to as the abortion pill. And it's actually two medications. So the first pill is called mifepristone. The second pill is called misoprostol. The first pill blocks the hormone progesterone, which is necessary to keep continuing a pregnancy. And then the second pill, misoprostol, causes contractions in the uterus that then expel the pregnancy. That second drug, misoprostol, can also be used on its own, also safe and effective dosages. And in many parts of the world, it's much more available and less expensive than mifepristone. But most commonly in the United States, people are using both drugs.
Thank you so much for that. And then your organization, Ibis Reproductive Health, is quoted saying the following. The ability to control one's fertility is a fundamental human right, but this right is not universally enjoyed and accessible to all. And so you also have a book called Power, Suffering, and the Struggle of Dignity, Human Rights Framework for Health and Why They Matter. And so what I take from both of those is that abortion, in your perspective, is a human rights issue. So how can we use a human rights approach, like in your book, or lens, to talk about this issue, or to get others who may not see merit in your paradigm to come to your side, or just to advocate for access to reproductive services?
Well, so in Latin America, where I have worked for a long time, they have used human rights in a legal way, but also a political and social organizing way. So they have a different set of norms to draw on. There are enshrined actually rights to health that include access to care, and abortion is reproductive health care. They also have framed it much more in terms of gender equality and equal protection, and as a matter of, inclusive democracy. And that's all been incredibly important in making legal gains, but it's also been equally important to socially decriminalize abortion. So to really organize, to change to kind of dismantle some of the traditional misinformation and shaming of women, and change the public debate, get this out into public, have people talking about it as a matter of social justice and fundamental rights and dignity, instead of sort of this private, shameful, stigmatized thing that people have to do in the shadows. And I think that has been helped in those places by the legal and the social interact, right? When we consider it just a private matter, we don't recognize how abortion is really part of the web of people's lives, and you make decisions based on your social relationships, your future plans, your possibilities to support a new child and your existing children possibly, all kinds of things. But I do think that we can learn from those examples and bring this out of the closet and destigmatize it by just making it something that we talk about as a matter of social justice and basic rights, much more.
Thank you for that. And Kelly, do you have a take on this?
Yeah, at IBIS we conduct all of our research in a human rights and reproductive justice lens. And just as a quick aside, the reproductive justice frame is really built on a human rights frame. And what is critically important about that frame is that the sort of the locus of control in this, whether you're deciding about what you want to happen to your pregnancy, or for us, how we identify, like, what are the important research questions, what are the important solutions to test, should be driven by the people most impacted themselves. And that is the way to respect dignity and autonomy of people, which are fundamental human rights. It's, the United States is an interesting place in the world because many places outside of the United States, the frame that Ali was just talking about is much more familiar and entrenched in constitutions. We have an office in South Africa, for example, and it's a very strong human rights-based constitution in that country. But here in the US, our exceptionalism means we also reject some of the global paradigms.
Right.
But I think it's really important to talk about, when you think about the global setting, the United Nations, there's been a special rapporteur on human rights who talked explicitly about abortion and reproductive health care as a critical human right. And so we at IBIS take that as our core lens about how we want to approach our research on this work.
Thank you so much for that. We're almost nearing the end. And I have so many more questions for you on this topic, but we might have to break this up into multiple segments and continue this conversation as things unfold. But as of right now, there's talk in Congress to work on a proposed bill, Women's Health and Protection Act, WHPA, and there are other talks about how to address the potential fallout from the overturning of Roe and Casey. And so I'm going to leave it all to you to tell us what's next. What should we expect? What are feasible solutions in case nothing changes in the draft that were leaked? And again, how to deal with everything, the storm that is brewing and coming.
So, I would be very gratified if the Women's Health Protection Act passed. But I think that with our congressional makeup are now, that is a remote possibility. So, you know, if this opinion turns out to be like the draft opinion and the issue goes back to the states, I think we'll see a ton of litigation on a number of different issues. And I think progressive activists need to really focus on state politics, reform of state laws, and social organizing and bringing this to the streets, as has been done elsewhere in other countries. Working across silos and working with providers, which has also been done elsewhere. Outreach to ensure that people who are capable of becoming pregnant or are currently pregnant know what their rights are, to claim rights and exceptions, as well as to access abortion funds and be able to travel. So I mean, I think the real thing is that this is not a time, nobody can sit this out. Everybody has to get up and stand up and start being loud and disruptive.
Thank you so much. And Kelly?
Yeah, I want to lift up, and maybe if you do another segment on this topic, it would be great to bring some of them into the conversation, but folks who have been working for abortion funds, for example. So abortion funds are largely volunteer organizations, and what they do is raise money and or provide practical support so that people can get the abortion care that they need. And abortion funds have been around for a long time, but what it's going to become increasingly important, particularly in states where there are many, many more restrictions, in the estimated 26 states where abortion will largely become unavailable if the decision looks like what we saw in the leaked draft. In those places, they're very grassroots organizations, they're local leaders. They are not only working in their communities to make sure people have the information that they need to get them to other places to access abortion care, they are also doing the on-the-ground organizing, getting people on the streets, working with their communities, and looking really at the long-term cultural change and political change that we seek. So I encourage everyone listening to this to find out who your local abortion fund is, to give money, to volunteer if you can. Those are real concrete ways to make a sort of practical difference in someone's life who needs abortion care. Because there's no doubt that we will see increased travel. We will see people who really would like to have a procedure abortion in a clinic who won't be able to get one. They unfortunately might, hopefully they can get a medication abortion instead, but we should be looking towards a future where people can have the type of abortion that they want. They shouldn't have to access clandestine pills as the only alternative. But we will see increased amounts of people accessing pills in a variety of different ways. We want to make sure that we have ways for people to get pills that are high quality, that they have whatever support they need when they self-manage their abortions. For some people, that might look like just doing it on their own. Other people might want someone to support them. Other people will have clinical questions. And so again, abortion funds and independent clinics that are on the ground and abortion providers today, I really just encourage people to find out what their local abortion infrastructure is. And just going back to something Ali said in the very beginning, this is a democracy issue. This is not, the attacks on abortion rights are not separate from attacks on voting rights, from attacks that we're seeing on the rights of transgender kids to access the care they need. This is part of a broader attack on people's very basic democratic rights to participate in our democracy. And so, again, it sometimes seems like not so powerful, but everybody needs to vote and get out there and vote for people who represent the way they want to see this country.
I would just underscore what Kelly said, that, who gets to exercise power over who, and who gets to control whose body? We've seen those debates in COVID. This is a very profound example of those questions, which could not be more fundamental to democratic governance.
Thank you so much. I really appreciate both of you taking your time to come on the show, and I look forward to working with you in the future.
Thank you so much.
Thanks, Tommy, so much.